patients that do have an infection with COVID-19 or the virus do shed the virus through their feces. And that's important. Not necessarily, it means that they would develop other symptoms. That means people who do not show other symptoms yet, and that would not necessarily show up for testing at the testing stations, would also provide a signal. So those patients are called asymptomatic or pre-symptomatic patients, and we can catch those with the wastewater analyses as well. We look for genetic traces of the virus in the wastewater. That means fragments of the virus or virus particles by themselves. We isolate them from the wastewater and then count basically how many of those copies of the genetic material are present in the wastewater. So early on when the pandemic hit, we really got interested in this topic. We had other projects with the wastewater treatment plant here in Saskatoon. And so it was kind of low-hanging fruit to start looking deeper into it. Other groups around the world had started doing this, in the Netherlands, for example. So we wanted to try it out. So then over the summer, we started a pilot project on this, developed methods, and started testing samples. I think October the 7th was the first sample we got where we saw an increase in the signal. At that time, we didn't have increases in case numbers yet, but the following week, we did start seeing those. So now we are pretty confident because we've been seeing subsequent increases in case numbers that we have for the city with about a week delay after we see the increases in the signal in our wastewater. In the past week, we've measured the highest numbers we've ever measured in the wastewater in Saskatoon here. Depending on which period you look at, this is 2.5 to 4-fold increase over the previous week, just in the viral signal in the wastewater. And if we saw similar increases previously, we would have seen also about a doubling of case numbers in the subsequent week, which gives us an indication that we might be expecting higher numbers, up to about 100 to maybe even 150 new cases each day in Saskatoon alone. I think it really is a good indication that we do need to be very careful if we are out and about. We need to try, as our chief medical health officer said, we need to try limit our contacts. We need to try limit how often we are out and shop and things like that. We should really limit our contacts to help and flatten that curve, or at least bend it. Yeah, this stage, our pilot testing comes to an end, but we're currently talking to all involved stakeholders to try and continue this type of research because we think it's really valuable, and early indications show that there is actually a lot of value in this method. So we are hopeful to continue this for the upcoming months, potentially up to a year, depending on whether or not and when we are getting a vaccine.